started. All right, thank you for joining us today. My name is Sarah Stephen. I'm the Director of Events and Product Marketing with BHA, and we are here with Christy Lehman. Christy Lehman is the Vice President of Minnesota Pets and is a licensed social worker. She's been doing veterinary social work for 8 years and has been with Minnesota Pets for 7 years. She's excited to be here to share her knowledge about supporting clients through the euthanasia experience and how to take care of your own well-being through the process as well. So welcome to Christy.
Thank you. Thank you so much. My dog was just barking, and so hopefully she got that out of the way right away and won't do that the whole time. The UPS guy just came. But I am really excited to talk about this topic of biases and end-of-life care. This is one of my favorite topics to talk about at Minnesota Pets, and hopefully I can share some things that are relevant for you in your practices too. A couple of things before I get started. I will make the slides themselves available. I'll send those over to Sarah so that you can access that through the VHA website. I have a lot of text on the slides, and so if there's anything you want to come back and read, I'll have those available. And then if questions come up or discussions or anything like that, I strongly encourage that, and you can put that right in the chat, and I will address it either as I go or right at the end here. So I just wanted to start with a very quick introduction of Minnesota Pets and DVM Center. Minnesota Pets is an in-home euthanasia practice here in the Twin Cities, and we have a location in Duluth. We've been around for about 11 years, and we focus only on in-home euthanasia and quality of life consults. And we also provide pickup and transportation of pets for cremation. And we're available 7 days a week, 363 days a year. And then DVM Center is our phone support team. It's actually a sister company. Oops, there's my dog again. So it's a sister company to Minnesota Pets, and that was founded in 2016. It's our large phone support team. We answer calls and schedule visits for Minnesota Pets, but we also do the same for other similar kind of small end-of-life practices around the US and Canada. So we answer calls, manage emails, schedule in-home euthanasia visits, and provide support to clients. Our team is made up of CVTs, vet assistants, social workers, just a really great interdisciplinary team. And we schedule about 19,000 phone or end-of-life visits each year. So we have quite a bit of experience, talking through euthanasia and end-of-life care with clients, and kind of wrestling with some of these ethical dilemmas or situations that kind of bring out biases at times. So a lot of what I'm talking about here is drawing on my experience as a social worker, but also, as a person who has answered phones and helped a team answer phones for those clients too. So what we're going to focus on today, I'm just going to move my camera over here. So today we're going to talk a little bit about the sources of moral distress in end-of-life care. It is very closely affiliated with biases. So we'll talk a little bit about that and how to just increase our awareness of our own biases and manage them in a way that allows us to move forward with our work and our clients in a way that we can feel good about, and how to take care of ourselves when we do encounter those things. And then steps we can take to continue the conversation after today. This is one of those topics where we are just going to be going to just a sliver of the whole topic. There's so much more that we could talk about that we don't have time for. So I'm going to cover what I can cover, and then I encourage you to have these conversations with your team afterwards as well. So a couple of limitations. I think of all of the talks that I've done here with VHA, this one is probably the toughest to do virtually without seeing all of your faces. It would be excellent to have a two-way conversation about these things. And unfortunately, during COVID, that's not an option. So I'm going to do my best to speak about this and encourage, some reflection and kind of self-discussion in a way. Normally, I would love to hear, everyone's thoughts and examples too, and feel free to put those in the chat as we go as well. When we talk about biases, there are also really broad implications in terms of biases around gender and race, and those really important things that really have implications for veterinary practices, from hiring staff to treatment options and how we interact with clients in that way. that is a very large topic, and I'm focusing just kind of on the snippet of end of life care when it comes to biases because that is my own area of expertise. But I did want to point out that if you're interested in that bigger discussion around biases, which I highly recommend, there's an excellent webinar. It was through the AVMA. It's called Unconscious Bias: How It Affects Us and Our Teams by Dr. Greenhill. I highly recommend it. It's excellent. It covers a lot more of that larger discussion. So today we'll focus on end of life care and biases there. So when we say bias in this context, we're talking about prejudice in favor of or against something, a situation, a person, a group, usually considered unfair, although it ranges, of course. There are some biases or stereotypes that we have that we see as maybe a little bit less harmful, and then the more obvious biases that we do know are harmful. We also talk about it in terms of a strong inclination or preconceived opinion about something. This, I think, is where it really comes into play with the discussions around end of life care. And these biases come from personal experiences, how we were raised, our cultural conditioning, upbringing, that sort of thing. So, in end of life veterinary care specifically, biases can affect how we engage with clients, how we build rapport, how we interact with them. They can also subtly impact how we offer emotional support. And I'll give some examples of how this might happen in a minute here. It can also affect how we present treatment options, what options we share with the client, what options we, present as valid options, how we validate and react to client decisions, how we kind of convey empathy as they're making decisions around end of life care, how we kind of subtly choose language to affirm or discuss care and decisions. And then I think, just as importantly, how we feel about giving and helping folks in our work, especially when it comes to end of life care, which can be just so emotional, of course, for the client, but, also for us as the veterinary team. So, talking about biases, I think, can be uncomfortable. I won't call on anyone or make anyone share examples, but I will share, a few examples that we've come across here at Minnesota Pets. And even though I think sometimes these discussions are uncomfortable because no one likes, admitting that they have biases, and sometimes it's uncomfortable to admit to ourselves or admit to others. But I think it's important because we owe it to our teams and our clients, being aware of our biases and knowing how they impact our interactions with clients and how we treat the patients. It helps us provide that same level of care to everyone. I also think we owe it to ourselves because it helps us better understand, our feelings around the dilemmas we're faced with every day. And we'll talk a little bit about moral distress. We'll talk a lot about it today, but when it's not what we would choose. So when we're doing something for a client that is not what we personally would choose as a pet owner, that can really weigh on us. And being more aware of our biases and where that's coming from and how to manage it is a form of self-care. And so that's why we've carved out some time today to focus on this. So, moral distress, some of you may have heard this. It's been in the research a little bit more in the last couple of years. It's the internal conflict we feel when we have to do something that we wish we didn't have to do. And I'm sure as I say that sentence out loud, many of you are like, this is, something that happens every day in veterinary medicine, and that's very true. So it commonly occurs when we're asked to treat a patient in a way that really is just inconsistent from what we would choose or what we think should be done. And I'll share a couple of examples here of how we might encounter this in end of life care. But I think the really important thing to note is that moral distress has been uncovered as one of the leading causes of compassion fatigue and burnout in veterinary medicine. And we know that that is a large problem in veterinary teams: compassion fatigue, burnout, and the mental health impact that that has. And they've really found that oftentimes it comes down to this repeated moral distress that we encounter. And again, that happens often in end of life care. Two of the most common sources of moral distress in end of life care situations would be when we wish the client would consider euthanasia, but they won't or they can't. So when we see a pet and we just really feel like the right thing for this pet would be euthanasia, but the client's not there yet, or it's not something they can or will consider. The study that I have cited here said that 70% of veterinarians reported being asked to provide care that they consider futile. And I know in a lot of my discussions with veterinary teams, this is really, some of the most painful experiences that they have in the clinic is when they just really wish they could help with euthanasia and the client's not there yet. It also can happen when we wish the client would consider treatment options instead of euthanasia, but they won't or they can't. I think this happens just as often, I think, but it's a little bit easier to navigate in that, we have the right to say, no, we cannot help with euthanasia. Whereas if we can't necessarily force a client to euthanize a pet, obviously, if they're not there yet. So this one, there's a little bit more of a boundary that we can set, but it's still something that, really causes a lot of distress repeatedly, I think, for a lot of people on veterinary teams. So, what is the goal when we talk about biases and being aware of them? The goal is not necessarily to not have any biases. That's really probably impossible for almost everyone. We're human beings. We have biases. We all have different upbringings and cultures and worldviews and values. And that's just part of what makes, everyone different and human beings. And so that's not something that we can necessarily override. But what we can do is really, get in touch with what our biases are. If we can identify that we have some common, triggers when it comes to biases, some things that we feel very strong about, and just sort of how to notice them and manage them and be more aware of them. We can't eliminate moral distress in this work. There are just too many conflicting forces at play: the client, the pet, the company or the practice, management. All of these things are constantly in conflict at times. And so it really isn't something that we can eliminate, but we can kind of learn to navigate it in a way that at the end of the day, we can look back and say, I feel really proud about how I worked, how I helped the client today. And research, this study that I've cited, it also found that veterinarians kind of reported feeling moral distress, but they didn't call it that. They didn't quite know what it was. They just said, they felt like something happened and it was upsetting. But when they dug a little bit deeper, they really uncovered that it's this moral distress element. So it's something that is helpful to become more aware of. So with bias, we talk about explicit bias and implicit bias. Explicit bias is kind of the easier one. It's the one that we can say out loud, I am biased about this, or if it were me, I would clearly do this. These are the things that our brain, can pick from and verbalize pretty easily. Behaviors related to this bias are intentional. So if I'm a person that, doesn't think that natural death is a good idea for a pet, my behavior, with my own pet is that I intentionally avoid that situation. That is something that would be clear in someone's brain that they could verbalize. An implicit bias is one that you're a little bit more unaware of. It's one that you maybe wouldn't verbalize, or maybe you don't realize that you have that bias. And the attitude is sort of shaped or subconsciously. And so the behavior and the decisions that come from that are impacted in a more kind of subtle, subconscious way. We may not realize that we reacted in a way because of an implicit bias. And I'm going to give a couple of examples here. So, an explicit bias would be, for example, women are more emotional than men. Let's say that is a belief that I have, and maybe it's a stereotype, but it's just something I've noticed, let's say. An implicit part of that bias would be kind of the resulting behavior, or, for a person that maybe wouldn't admit that out loud as something that they believe, they might find that they're kind of subtly or subconsciously offering emotional support or grief resources to a female client after a loss, but not a male client. And I wanted to include this specific example because this is something that I actually noticed that at times I was doing a little bit on the phone with clients. I would have maybe a stoic man call to schedule a euthanasia visit. And I just noticed that I didn't have the same reaction. I didn't have the same, invitation to share or provide support to them in the same way. And so when I really kind of noticed that and started intentionally going out of my way to say, some more empathic phrasing and statements and inviting them to share their story, that's oftentimes when they would no longer be stoic. That's oftentimes when they would kind of break down a little bit. And so that's an example I wanted to share because I noticed that in myself. And I think that's probably kind of a common one in end of life care. You might say, or kind of note out loud or to yourself, this client spent a lot of money on their pet, they must really love them. That might be a viewpoint that we have. An implicit way for that bias to peek through would be if we validate a decision more from a client who did kind of spend that much money or pursue those treatment options versus a client who didn't. Or if we say, I think when a pet can't get up anymore, that's when it's time for euthanasia. That's a explicit bias. The implicit kind of counterpoint of that would be emphasizing euthanasia referrals versus discussing mobility aids. So you may not, say that explicitly, but implicitly you might find yourself, maybe offering different kinds of choices for that client. You might also believe, there's just never a reason that a person should let their pet suffer. An implicit counterpoint, again, would be providing natural death education, or I guess not providing natural death education as much as euthanasia education. So those are just a few examples that I kind of want you to keep in mind, although I'm going to tackle a few more too. There are other ways that biases come into play. Of course, if we assume income and finances, I'm sure that you can imagine, how that might play a role, especially in end of life care when we're discussing, some possible options for treatment or euthanasia or rehoming, those sort of situations. Client age. There have been studies to even show that client weight impacts the treatment options or how we interact with the pet, which I found really interesting. And again, some of these I won't get into as much. That AVMA webinar is excellent for some of these. But I just encourage you to really think about all of the ways that our biases could come into play. Culture, religion, gender. I talked about that example, of course, race and ethnicity. So as we go through a couple of examples in a moment, I just want you to be thinking about all of these characteristics of clients and situations that you might encounter that really have an opportunity for our biases to come through, even when we wish that it wouldn't be the case, or we would like to think that we aren't a person that are, that's impacted by that. It's still definitely, a possibility and a reality for many of us. So in end of life care, we know that it's emotional. It's highly emotional for clients, of course, but it can be highly emotional for us too. And especially, in a clinic setting where you have worked with that family and that pet maybe for many years, you know them. That's even more emotional than it would be, for example, at Minnesota Pets when we're meeting them for the first time. So there is no doubt that end of life care is a highly stressful situation in a veterinary clinic. We also know that highly stressful situations impact our biases and our kind of ability to manage them. Heuristics, which are really just mental shortcuts. When we don't have time to really, think through everything, our brain kind of zaps to the point. And those mental shortcuts, biases play a huge role in those. And that comes into play more often when we are stressed and we're emotional, we're working under pressure, we're tired, all of those times when our brain might not be firing at 150%, which, as you're probably reading this, you're thinking that's like most of my days at work, especially when we're busy or a busy time of year. And that's definitely true. And so these biases can come into play more often, especially when we don't have that moment in situations to stop and kind of breathe or take a moment to just reflect on our gut feeling. So we'll talk a little bit about that too. But the truth is that our work every day is just not conducive for slowing down and thinking through and, being mindful of biases. These are things that happen really fast throughout the day. And then when clients are obviously very emotional and feeling very vulnerable, even our most subtle kind of subconscious biases and how that affects our behavior toward them or our interactions toward them, that can be picked up in subtle ways for clients and how they feel supported or spoken to. And so that's another reason that it's just really important to kind of self-reflect and become more aware of them. So I want to go through a couple of examples, and I just want you, and this is where it would be nice if we were in a room together and I could, see everyone's faces, but I'm just going to pretend like I can, and I'm going to read through a couple of examples, and I want you to just notice, when I read it, what is your gut reaction? And there's no wrong or right answer, and we'll kind of talk about that at the end too, but it's very natural to have gut reactions. That's just part of being a human being. So think about what those would be. So, for the first example, you have a client who says, I'm working with my pet communicator, and they told me that even though Buddy has cancer and doesn't eat or drink anymore, he's a fighter and he isn't ready to leave me. And so these are some conversations that we've had here at Minnesota Pets. You may have had similar conversations with clients at the clinic. So I just kind of want to take a moment for you to note your gut feeling, how you would interact. You're seeing Buddy, he's there, he's not eating, he's really not feeling well, and you hear this phrase from your client. So I am going to assume some gut reactions. Normally I would, ask you in the crowd to share some thoughts, but I will just assume here that probably some of the really common gut reactions would be, to discredit the client's viewpoint, maybe, in internal eye rolls for some people, depending on how strong your feelings are about it, or, almost feeling angry, like you're looking at Buddy, he's not feeling well. How is that not obvious? That sort of moment of really feeling for the pet. And you might really jump into convincing them that euthanasia is the most appropriate option, or convincing them that their pet communicator isn't on track with what you're seeing with Buddy. Those gut feelings are not right or wrong, they're just gut feelings. They're just our physical kind of response to it. So some alternatives I want to propose, and I'll do this for each example, is just to kind of use that as an alert, that gut feeling, an alert to explore further, really understand the situation. So to ask the client some questions, how do you feel about what the communicator told you? Do you agree that Buddy isn't ready? What else is telling you that he isn't ready? Kind of leaning into that to get some more information. And then kind of knowing, okay, the client's not there yet, the pet communicator, played a role in that potentially, and maybe not. Maybe the client wasn't there yet, and the pet communicator kind of tuned into that, and that's part of the conversation. We don't know, but we know the client's not there yet. And so what we could do is offer some supportive options, kind of that harm reduction approach of like, well, I can't convince or I can't, lead this client to euthanasia, but I can talk about palliative care, pain management, appetite stimulation. I can give them some education around natural death, what they could expect, how they can best companion their animal through that. And I'll talk a little bit more about that in a moment too. And then talking about emergency plans. And so I'm going to talk about a natural death on another slide. But those are some things that if we just immediately kind of jump into convincing them that euthanasia is the most appropriate option when they're not quite there yet, we may miss some really important parts of that conversation. In social work and counseling, we talk a lot about meeting the client where they are. And it's really situations like this where it's important to meet them where they are. And the other interesting thing I want to note about this animal communicator situation, some people have really strong biases for it or against it, or just strong feelings about it on veterinary teams. And what I find interesting is that if I would have prefaced that slide by saying, I want you to think about whether you have any biases about client spirituality or ideas around that, I think most of us would have said, no, I'm totally open to different spiritual views and different religions and that sort of thing. But for some reason, the idea or that situation in the slide, I think triggers some of us, to realize we do kind of have a bias around some of those different spiritual views. And so I just wanted to put that out there. Again, none of these are bad or right or wrong. These are just things to kind of notice in yourself and notice if this has come up, for your team. Okay, so the second example, you have a client who says, my 10-year-old dog is getting too aggressive. I never know when he will snap. Last week, he tried to bite my 5-year-old. I can't even let him out of his kennel in the apartment. I wish there was another option, but I think it's time to have him put down. I can't afford to be sued. He's very unhappy, and I don't want to risk a serious injury to someone. So I think for a lot of us, when we get these kind of calls for aggression or behavior cases, requesting end of life care and euthanasia, I think our first reaction comes from a place of skepticism, which I don't think is wrong. I think, it's part of why we're all here. We're here for the animals, of course. And so to come from a point where we want to advocate for the animal is very, very natural. And I think okay. And and in some ways good probably to have some level of skepticism, but it is really important to use that as a starting point for exploration. So some of the questions I would just have you think about in this case would be, do you feel like it's possible that your reaction to that client was influenced by your assumption of maybe their income? I, of course, I can't see anyone's faces or engage in any discussion, so I'm just kind of asking some rhetorical questions for everyone to reflect on. But some of the ways that could come into play would be how they're dressed, if you know what they do for a living, what part of the city they live in, or what part of the city your clinic is in. If they mention, living in an apartment versus a house or that sort of thing, does that impact your kind of empathy for their situation in any way, or your assumption of maybe what they've already tried with their pet? Would you say it's possible that your reaction is influenced by their race or their primary language? Um, would you find yourself maybe offering more support to one type of client over another? Again, these are difficult things to reflect on, and we may not know the answer, unless we're in that situation, but it's just something to think about. Do you think that it's possible you would find yourself offering referrals to behaviorists or training programs, training classes, an in-home trainer, that sort of thing, um, versus some clients maybe emphasizing things like rehoming or contacting rescues? I think for a lot of us, this situation especially is difficult because there are so many nuances and there are so many situations, but I think this is an example that comes up quite often. I know that it definitely does for our team, and we're a little bit limited in that we are on the phone. So sometimes I think, our receptionists, the bias can come through in what we hear, the words, the tone. I've had clients who call and they may say the exact same thing as, they may say this exact phrase, but they're saying it through tears. They're saying it through, just clear agony and devastation. And I tend to react differently or have a different gut reaction to that situation than if they call in a more angry tone or less emotional tone. And it would be very natural for someone to be angry because their dog tried to bite their child, and people get exhausted with those situations. And I've noticed that it does change. In a moment, I feel a gut reaction to how the client's tone sounds. And so it's little subtle things like that that are really important to tune into, just to become aware of and try to counteract. The next example, we have a client who says, "What do you mean I have to wear a mask? Aren't you all vaccinated by now? I'm supposed to pay this huge amount of money and I have to wear a mask and I can't even come inside with my dog when you put him down." I'm sure this is something that you guys have encountered in your clinics. We have definitely had these conversations with Minnesota Pets. We've had clients who say, "I'm in my own home and you expect me to wear a mask, and it's so expensive," and that sort of thing. So this is definitely something that we've come across, and depending on, all of our varied views on masks and vaccination and all of those things, which I know has been a difficult topic, in the past few months in our country, it can bring out really important and kind of big gut feelings. So some of the things that you could kind of reflect on, um, if this has happened to you, or if you feel like this is a possibility that it could, do you feel like your gut reaction, your feelings could impact your ability to provide support to this person? Or do you feel like you'd be inclined to validate and empathize? I think this is a really tough question because I think most of us would say, I don't enjoy validating or empathizing or exercising a lot of compassion to people who make me feel bad in any way. And so I think it's really valid to feel that way if that's the case for you. Do you feel like your feelings impact your decision to want to help this person? Do you think that it could cloud your understanding of this person's grief or their heartbreak about losing their pet? Do you think, I guess, in general, that your feelings could impact your ability to feel good about helping this client? And I think this is a really important question to ask because I think oftentimes it doesn't feel good to help people who make us feel bad. And doing that over and over, I think can be, it can play a role in compassion fatigue. And that's something to process and debrief about, which we'll talk about in this talk as well. But I think this is really important because these are things that are so natural. And I think it's helpful to notice them for yourself in the moment, and even just, feel aware of them. I also feel like it's really easy for us to not do the extra work of validating and empathizing with clients who make us feel bad. And in this case, feeling bad would be, well, I'm asking you to wear a mask for my protection and you don't want to, and that makes me feel bad. And now I have to, show compassion to you. It's just a bunch of conflicting feelings all at once. And the difficulty is that this person is also, heartbroken. They're facing a difficult decision. They're grieving their pet, and we're expected to support them, and we want to be able to support them, but that is hard to do when we're feeling bad. So I think these are all things to just kind of note for yourself and reflect on how this might feel for you if you feel like your own biases about the situation and COVID protocols and masking, if that could come through. And the last example I have would be a client who says, Bailey stopped eating 2 days ago. She seems pretty weak. I know we can't cure hemangiosarcoma, but I still want to have a few weeks with her. I definitely don't want to euthanize her. That feels like murder, and I'm not going to play God. I'm just going to wait and let her pass away peacefully in her sleep. So I'm assuming that this is a situation that you encounter in the clinic, maybe, well, of course, more so than we encounter here at Minnesota Pets. Most clients who call us are calling us because they're considering euthanasia. So we don't see this quite as often. I know in the clinic that's where you see it. And I think this is really difficult. What we do see at Minnesota Pets is when clients call and they want to schedule, a week and a half from now when their daughter flies home from college, but we're hearing these symptoms, and we're really concerned about Bailey waiting that long. And, we just imagine what that might be like for Bailey, or what the potential, crisis could be. So I think this is something that definitely can cause moral distress. It may not be what we choose for our own pet, and that brings up a lot of emotions for us. So some of the possibilities would be to invalidate the client's perspective, either subtly or a little bit more, strongly or explicitly. We may try to jump in and convince them that euthanasia is the most appropriate option. I think this would be a very, very natural experience. I found myself in this position many times, and kind of having to slow down and feel aware of how I'm feeling about it and separate that from, what the client needs in the moment. This is, I think, one of the most difficult situations in end of life care, when we feel just with every ounce of our being that we would not choose what this person is choosing. And it's not about us, and it's not about the person, it's about the pet that we're looking at who's not feeling well. And I think that that's, a very, very valid and natural feeling to have, and something to, feel okay about feeling, because it's so normal. When this happens, and this when this happens at Minnesota Pets, this is usually a group conversation that we have in person or via Slack, where we just kind of talk each other through it, because it is so normal for our own bias and our own choice to kind of shine through and cloud everything else. So I think with this sort of interaction, it's really important to try to approach from a place of empathy and gentleness and support, to try to meet the client where they are, like I mentioned earlier, and really use this as an alert to explore for further understanding. So, can I tell you a little bit more about this diagnosis? Has anyone talked to you about what a natural death could look like for Bailey, or what you could expect? Another question that I think is really helpful to ask when you have a client who's really resistant to euthanasia would be, have you ever experienced euthanasia with a pet before? I've asked clients this question before when they either seem very, very hesitant, when I think the choice seems sort of clear, the pet is clearly struggling, but the owner's not quite there yet. I'll just gently ask them if they've ever gone through this before. Very often they will say, no, I never have, and doing some education around what they can expect, how it feels for the pet, what happens, that helps them feel a little bit more comfortable with the idea. And then I also have some clients who say, yes, and it was horrible. Yes, I remember doing this when my parents euthanized my dog when I was 7 years old, and it was terrible. Or, I had a cat who had a terrible reaction to the sedative the last time I did this, and that's really causing their hesitancy. There are so many reasons why someone would hesitate, and some people just believe that it's not the right thing to do, it's not their place. Depending on their culture or their religion or spirituality, that might be something that they just cannot do. And I think, as difficult as that is valid for that client, and we can do our part in educating and kind of supporting to make it as comfortable as possible for the pet in as much as we can. So some options would be offering some supportive options, education around natural death. I think this is really important. Like I mentioned in a previous slide, some clients think, that if their pet is ill and they don't euthanize them, eventually the pet will just pass away peacefully in their sleep. We know sometimes that does happen, but we also know sometimes, obviously, that does not happen, and it can be a really uncomfortable and just sort of ugly event depending on the diagnosis. Clients may not realize this, they've never been through this potentially. So it's really important to give them some education around what they can expect, and how they can kind of be there with their pet. It's also really important to talk about emergency plans and helping clients know if it's an emergency plan. So in this case with Bailey, talking about looking at the color of their gums or that sort of thing, that's very helpful. But also to say, and this is something I say in phone calls with clients very often, do you have a plan if something were to happen with Bailey in the middle of the night? Oftentimes just asking that question helps them kind of think through, like, oh, really think that I didn't think about that as an option, or I didn't think of that as an outcome. Now that I think about that, I realize how much I don't want to have to run to the emergency room in the middle of the night, or, hold Bailey as she's uncomfortably passing away. Just kind of asking those open-ended questions is a way to help the client get to that point without pushing them or without, convincing them. Because in the end, it's their decision that they will have to live with, for the rest of their lives. We want them to come to that decision in a way that feels right for them and in a way that honors their relationship with their pet. And we can kind of support them along the way, sharing the education and sharing what we know about the pet's condition. So, like I said, it's okay if your honest reactions are strong or if they contain bias. We are all human beings. We have all had our own lifetime of experiences and upbringing and worldviews. That is not something we can avoid. The important thing, I think, is really to understand how to become aware of your feelings, how to understand that it is a bias, kind of moving it from an implicit bias to the explicit part of your brain where you say, oh, okay, I had this experience, with a pet when I was younger. That's why I feel so strongly about it. And so I think that's really important. And the goal is really to support the client, but also to feel at peace about the work you're doing and the support that you're giving them. I'm just going to check the time here. Okay. So to increase awareness, and we do know research shows that awareness of bias can lead to reversals in biased outcomes. So it can lead to less biased behavior or interactions. So very importantly would be self-reflection. And I don't know how many of you have, done a lot of this self-reflection, but when it comes to end-of-life care for pets, I think it really is helpful to reflect on, the types of experiences you have had or that you had early in your life that kind of shape your perspective, or the experiences that you've had professionally, and what has led you to kind of have these views and have these opinions. As medical professionals, they're not incorrect, to think, well, I don't think we should wait for Bailey, who has hemangiosarcoma. That is a very valid, it's an opinion, but it's based on so much experience and education and fact. And so to think of that as a bias might be a little bit of a stretch, but I do think it's important to think about some of those things, or things like pet communicators, or these other examples that we've talked about. Um, if you haven't ever gone through this with a pet before, if you have, it's probably more clear to you, but I think it is really helpful to think about your own personal values, the decisions you would make for your own pet, where your line in the sand is, at what point you feel that euthanasia is the right point for you, and just becoming aware of that, and kind of reflecting on what that means for you. It can help you understand more when you're having a gut reaction to something a client is saying or a decision that they're making. Debriefing is a very important way to build awareness, and I'll talk about that in a moment. And then in the moment awareness. So really noticing the physical reaction you have to what a client is saying or what's going on. Your heart rate increases, you might jump in too quickly. Really notice those negative gut reactions and lean into them. Use them as a cue to learn more. So rather than hearing this client's pet communicator says it's not time, so I just need to jump into convincing them, or like almost a step back from this client, I don't think I can really get through to them. Treat it the opposite. Treat it as a cue to lean in and ask more questions and try to understand more deeply. So when you kind of have those gut reactions, or you kind of notice a bias coming through, really actively explore and challenge that. And just kind of think, if I ask 20 questions about what this client's experience is with their pet communicator and what they told them about their pet, I will understand this better. It'll help me counteract. So really using it as a cue can be helpful. So this circle here on this previous slide, that is where that kind of in the moment self-reflection happens. It's kind of in between that place where we're noticing it, we feel something or we verbalize something, and it's at that moment that we're kind of in tune with that and we're aware of that, and that can shape our next steps, which is usually our behavior or our words or our interaction with the client. That's where that in the moment awareness is really helpful. This feels very obvious, to say, well, pay attention to your gut feeling or how you're physically feeling. That seems so obvious, but when we're in a very busy shift in a very busy clinic and it's just a person after a person and interaction after an interaction, it is really something that fades away. We kind of go on autopilot. We don't tune into ourselves as often. I really encourage you to kind of tune back into that and nourish that self-reflection in the moment a little bit more. So when we talk about exploration, I think it really is important to tune into the client's role in the pet's quality of life. I think for a lot of us, this is where the bias comes in, because it's not what we would choose for our own pet. Our role in our pet's quality of life might be different as veterinary professionals, whereas when we're talking to a client, their role in their pet's quality of life is just going to look different than ours. And the weight that plays in their decision around end of life care is going to be different from ours. A lot of clients feel guilt about their role in their pet's quality of life. I would say in talking to people who are deciding about euthanasia, and also in talking to people after euthanasia through phone calls and counseling and support groups, this guilt that they feel on both ends is really related to their role. Did I go to the vet quick enough? Did I get this looked at quick enough? What if I had done this? What if I had done that? What if I wouldn't have moved to a home that had stairs? Then, Bailey wouldn't have fallen down them. Everything that you can think of that is related to something in their control, they can feel guilty about and likely will. And so this is a really important part of the quality of life discussion. We often see the owner's ability to meet the pet's needs as kind of less important than the pet's symptoms, when I think that they are equally important if we kind of make space to talk through them. So it's really important to have that as part of the discussion. So a couple of examples would be, an older client has an elderly pet who is mostly immobile and they're struggling to continue carrying them outside. Maybe a person who is younger or totally able-bodied, maybe they can carry their pet in and out, and their pet can continue to, eat their food and cuddle and mostly be happy for at least some more time. But an older client or someone who can't physically lift their pet doesn't have that same ability. A pet whose chronic inappropriate urination has not responded to interventions, and now the owner is at risk of losing their apartment or their roommates, or something that, financially or in that client's life is extremely important. That is something that is worth discussing and worth digging into and understanding. Or a client who has a trip coming up. We have these calls often with Minnesota Pets where a pet is already kind of not doing well and toward the end of their life, or they're being really given some like home hospice care by their owner, and the owner has a trip. No matter what the reason is, it could be a business trip they can't get out of, or it could be a well-deserved vacation, clients often call and they mention that as something they feel awful about and something that they think is bad that they're considering. And we have to kind of validate, well, of course, it makes sense that you would worry about Buddy when you're on your trip. So that is something that we should make room for, and we should hear them out as a valid, reason that they're considering euthanasia, or just as a valid part of the quality of life discussion. One of the ways I like to do this and make room for it is using a quality of life scale that includes some elements of the owner's ability to care for their pet, or just the owner's experience in general. So when we have these discussions, it is important to kind of go into them prepared to show patience and to kind of have that open mind ready to know, like, I know this person may note things that are different than what I would choose. And that's just, part of that interaction and the exploration and understanding. So we like to use the journey scale developed by Dr. Hilst. This scale I like because it has two elements that really bring the owner's experience in, as well as the client's condition and symptoms and overall quality of life, because the pet's quality of life and the owner's quality of life are very deeply intertwined. That's the beauty of the human animal bond. So when the owner's quality of life is also very impacted by the pet's condition, that is something worth talking about. So we have this scale on our website, and if you Google it, you'll find it a few different places too. This is my favorite one, and I really like to go through each of these things with clients on the phone, or I'll have a discussion with them and I'll have them kind of go do this as homework alone or with their family. And I think this is a really important way to include them in the conversation and just to validate that their experience is also a valid part of their pet's quality of life. So when we talk about exploring, that is this idea of interacting with the goal of really understanding the client's full picture, their full experience. It helps us interact with them better, provide support better. It helps us treat their patient or their pet better. So my favorite way of doing this, of course, would be through open-ended questions. So asking things like, what is your goal for Buddy's remaining days? What is your goal for Buddy's passing? I think we talk a lot about quality of life, and we talk a little bit less about quality of death. And that kind of question can be really helpful in situations like we talked about with Bailey, with hemangiosarcoma, with pets who we think may have a very uncomfortable death if we don't help with euthanasia. It would be helpful to talk to the client, like, what do you see as important for Buddy's goodbye? And to just hear, do they want to be at home? Do they want to be present? Do they want the whole family present? Do they want these different things? Or maybe that is less important and they would rather have as much time as possible. And the idea of driving to an emergency clinic maybe isn't as scary for that client. So that just helps you understand where they are with that. Asking them, what can I do to best support you? Or asking permission, would you like me to talk to you about XYZ options? Some clients are already decided on euthanasia, and you may not be sure if they're open to talking about pain medication or palliative care. So asking them, would you like me to talk about these things with you? If it's behavior related, to talk to them about, would you like me to give you some resources for rescues or for trainers? Just asking them just simply, how are you coping with these changes that you're seeing? Some clients have a lot of patience and stamina to keep up with that level of care, and they will do that as long as necessary. And some clients don't have that capacity, either, emotionally, or just their work schedule or their, physical ability, those sort of things. How are you feeling about continuing this level of care for Fluffy? And then sometimes I like to say, everyone draws that line in a different place in terms of knowing when it's time for euthanasia. When would you no longer be comfortable with her quality of life? And hearing from the client, I've asked this question many, many times, and the answers that I get are so varied that I found it really a valuable question to ask. I hear clients who say, when she no longer no longer wags her tail, or when she no longer plays, or when she can no longer go for her daily walk, or when she can no longer eat, or any combination of those things. And it's really variable between clients and between pets. And it gives you a lot of insight into what's important for that person and what's been important for that pet and their relationship. And sometimes I'll even have clients make note of those and make a list of those things so that they can see when things are sort of changing. So, lastly, I just want to talk a little bit about how to create a culture of debriefing. We've talked about how to be aware of and sort of manage our biases so that we can prevent or provide really high quality, supportive care for clients and patients. But I want to talk for a minute about how we can do that while also taking care of ourselves and preventing burnout and that kind of ongoing moral distress. So, research has shown that moral climates, so clinics or organizations that have these moral climates, are places where dilemmas and biases really can be discussed safely, and they have better outcomes in terms of compassion fatigue and burnout. Debriefing, which I'm sure you've heard that phrase before, but debriefing is a activity that you can do either with your team or with your your supervisor or coworker, even by yourself or with whoever is at home with you, where you really just talk through the events or the interaction with the goal not of, just venting or getting it off our chest, which is also important, but the goal of really kind of better understanding it for ourselves, processing it, sharing how we feel about it, and then learning and growing from it, and then kind of leaving it behind. I think of these kind of high stress or high emotional or moral distressing situations as sort of a wet rag, and you squeeze out as much as you can. And every learning, every possible, way that you can grow from it. And once you've done that, it's really important to just leave the rest behind. And I think this is a way for us to be able to do that after a difficult shift or an interaction, because we do have to move on and show up again tomorrow or go into the next room. And so learning ways to do this even in the moment throughout the day is really helpful. So effective debriefing happens when people feel safe sharing. So, kind of building that culture in your clinic where you're encouraging people to talk through things, you're encouraging them to be vulnerable and feel okay admitting biases or admitting mistakes or admitting just things they wish they would have said or done differently or better, and then keeping that goal of learning and understanding and supporting each other. At Minnesota Pets, we're all virtual right now during COVID, and we have a Slack channel where that's where people go to just kind of say, oh, this thing happened and I just can't stop thinking about it, or I can't shake, it just didn't feel right, or it didn't go well. And then everyone can kind of chime in and say, that happened to me too, or, it sounds like you handled it well, that sort of thing. If you don't currently have that at your clinic, I hope everyone has, a culture where they can do that. But I also know that isn't always the case. If you don't have that, if you don't necessarily have a coworker or manager that you can, feel safe being that vulnerable with, it is also possible and helpful to self-debrief through journaling or talking to a trusted friend or a colleague, someone in the field or just someone, at home, and just that self-reflection. So even on your drive home from the clinic, kind of reflecting on some of these things. And I think it's either in May or June. The next talk that we're doing is compassionate detachment. And we'll talk a lot about debriefing and self debriefing then, and a list of prompts for self reflection and journaling too. So we'll get into that a lot more. I feel like this slide could be its own talk and kind of will be. So if you'd like to learn more about debriefing, I definitely recommend that talk too. So, what you can do next, these are conversations that I think are really good for teams to have together. Really being supportive of your teammates in debriefing, asking people if they want to debrief. I know that in a clinic, you don't necessarily have time to do that. I would encourage you to think creatively about how you can have time to do that, or if you have the ability to set up structured debriefing time. So, if you have a time when everyone eats lunch together or something, can you designate one of those each week to just debriefing a difficult case or a difficult interaction? It can be structured, it can be casual, it can be with your team, it can be alone. Any way that you do it is helpful to really process through what happened in an honest way, with the goal of learning. I would also encourage you to notice your reaction. So that's kind of, I guess, your homework. When you have these interactions with clients, really tuning into your gut feeling and just kind of, gently asking yourself, like, what is this about? And just curiously, asking yourself. It's not a bad thing to have biases, but it is something that you want to be aware of so that you can better understand it and counteract it and explore it. Spend some time self-reflecting. We talked about, understanding better where our thoughts about end-of-life care come from. Is it our childhood? Is it the cases that we've seen? Is it a terrible case we saw while we were in vet school that has just really stuck with us? Anything that has played into some of our, our most strongly held values around end-of-life care is good to understand. And then I think, most importantly, really think about developing these universal protocols. I had mentioned earlier that in my time, answering phones for Minnesota Pets, early on, I kind of noticed myself offering emotional support to women than men when I was on the phone, and kind of catching myself and thinking, gosh, what is that about? That is not something I would have explicitly thought of or verbalized or expected from myself. And so now I have, kind of a script which makes it sound very insincere, but it is sincere for every person that I talk to, but it's just my way of making sure that I am really reacting to every single client with the same compassion, that I would the next client. And I think anytime you can have sort of universal protocols and resources. For example, we've talked about this a lot at Minnesota Pets and in previous talks, but having a mental health or pet loss referral sheet and including the whole, range of resources, everything from, the suicide hotline to, a book about pet loss, and being able to give that to every single client, no matter what, or including it in the condolence card, not just for the clients that you think might need it or that seemed kind of sad, when they were with you. So those sort of universal protocols are really helpful, and it just decreases the chance that your biases will come through and impact the way that you're providing emotional support to those clients. So I think we have a couple minutes left, so we can either wrap up early, or if anyone has any questions or examples that they want to share, definitely feel free to drop that in the chat. And I have my phone number and email address here. So if there is anything that people would like to talk more about or get some more information on, feel free to reach out anytime.
Perfect. Thank you, Christy. We'll probably give people a couple minutes if they want to add something to the chat box. Otherwise, be sure to mark your calendars for Thursday, May 20th. That is our next webinar with Christy. It's Carrying the Right Amount, Techniques for Compassionate Detachment. And it will be at the same time, 12 o'clock.
It's so rare that I finish early and not late, so
right?
I'm glad it worked out that way.
Perfect. And I'm not seeing any questions coming through on the chat, so I will thank everybody for joining us today. And a big thank you to Christy for speaking.
Yes, thank you so much.
Thank you.